Mr. Ramirez. My name is Isabel. How are you doing today?
Doing pretty good.
So, what bring you today?
Do my yearly physical.
Yearly physical? Do you have any chronic illness or medical condition?
No.
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 Do you take any medication or vitamins?
I take Centrum and I take Omega 3.
Okay. Are you allergic to any medication or food?
Yes, I'm allergic to penicillin.
And what will be your reaction to it?
Skin rash.
Okay. So, have you had any childhood illnesses?
No.
No. Have you had any surgery?
Yep, I had rotator cuff surgery on my left shoulder.
And do you remember when it was?
It was April 2010.
Do you were hospitalized?
Nope, it was ambulatory, so I was able to go home same day.
So you don't have any complications with that surgery?
No.
Okay. So I'm going to ask you about your family history to kind of know a little bit more about if there's any disease that runs in your family. I'm going to ask you about your grandparents. So when I ask you, I would like if you remember, you can tell me if they're alive or if they died and how old they were or how old they are and if they suffer from any chronic illnesses. So how about your maternal grandmother?
My maternal grandmother, she was chronic asthmatic, and she died from liver failure at the age of 55.
Okay. And your paternal grandmother?
My paternal grandmother, she passed away from heart problems.
Heart problems.
She died at the age of 65.
65. And your paternal grandfather?
My paternal grandfather, he was also chronic asthmatic, and he died from an asthma attack at the age of 60.
And I will ask you, and your mother?
How about my paternal grandfather?
I haven't, your paternal grandfather.
My paternal grandfather, he's still alive. He's 77 right now. He suffers from depression. He has anxiety. And he has type 1 diabetes.
Okay. So, your mother?
My mom, she's still alive. She suffers from chronic asthma, depression. She has heart problems. She had open heart surgery. And she suffers from sarcoidosis.
Sarcoidosis, okay. And your father?
My father, he's deceased. He suffered from type 1 diabetes. He had other chronic problems, but he died of pneumonia.
Okay.
At the age of 59.
59? Okay, thank you. And do you have any brothers or sisters?
Yep, I have a brother and a sister.
Are they healthy? Do they suffer any condition?
Nope, my brother's pretty much healthy, my sister's pretty much healthy, but she has mental retardation and she is blind.
Who you live with, Mr. Ramirez?
I live with my significant other
Do you have
and
kids?
my 2 boys.
2 boys? Okay. So, in your role as a family member, how would you consider yourself?
I'm the head of the household.
Okay. How about your appetite, your diet? Like, do you have a good appetite? What is basically your diet during the day? Like,
Yeah,
a normal day, what would you eat?
I have a very good diet. I mean, I eat 95% of my food. My appetite is pretty good. Usually for breakfast, I have like bread with toast with butter, or I have a bagel with cream cheese. I usually drink coffee and stuff like that in the morning. I don't eat lunch most of the time. I drink water during the day, and I eat trail mixes. And usually in the afternoon, I have a good dinner. I eat chicken, vegetables and rice. I'll have like spaghetti with turkey meat, stuff like that.
Do you have any problems with doing any activity of your daily living, like bathing? You don't have any. Okay. How about, do you suffer from any anxiety, depression, or?
I usually do. I'm over anxious. I do have anxiety, and sometimes I do get depressed. I do suffer from depression sometimes.
And what would you do to cope with your anxiety or your depression? Do you take any type of medication? Have you gone look for any professional help?
No, I haven't. I've never gone up to get professional help. I'm usually self-medicate. I usually drink beer, and I smoke cigarettes to cope with my anxiety.
And do you get stressed a lot? Or if
No,
you
not
get
really.
stressed, how you deal with your, like if you...
I usually take a walk or something like that.
Okay, so you already mentioned your habits. You smoke cigarettes and you drink alcohol. So how many packs of cigarettes a day will you smoke?
I'm not a heavy smoker. I only smoke 3 to 4 cigarettes a day.
Okay. And how about alcohol? What type of alcohol do you drink?
I usually drink beers, and I normally have like maybe 5 or 6 beers, and I do it maybe twice a week.
Do you abuse any prescription drugs or any illicit drugs?
No.
Okay. Okay. Do you do exercise or
No, not for the most part. I don't do any exercise.
no exercise? Do you go? Do you perform any self-examination? You check your testicles once a month?
No.
No. Do you go to yearly screening? You go to do, obviously you're here because you're doing your physical, so you,
Yes, I get a physical done at least once a year.
and in your physical, what you get done in your physical?
I usually get checked physically, make sure I'm okay. They do lab work, and I also get a prostate examination.
Okay. Do you brush your teeth every day?
Yes, I brush my teeth once every day.
Once a day. And how about flossing?
I do flossing maybe once every 2 days or so.
Every 2 days. You know that it's really important that you brush your teeth at least twice a day, I'm sorry, and then you floss your teeth every day because that could prevent you from developing a lot of condition. And how about where you live? Where you live at? Do you live in a house? Do you live in an apartment? Do you live?
I live in a multi-family house in an apartment.
And how do you feel safe in your apartment? Do your apartment have every other safety equipment that you need, like for example, fire extinguisher or smoke alarm?
Yes, I have everything. CO2 detector, smoke alarm, fire extinguisher.
And do you work?
Yes.
And where you work at?
I work at Coca-Cola. I am a
what
truck
type of-
driver
you're a
for
truck
Coca-Cola.
driver. Okay. Okay, Mr. Ramirez. The only thing I see, at least in your history, with you is the fact that you have a lot of relatives that, not a lot of relatives, your closest relative that they suffer from. You have a lot of diabetes, heart disease, and asthma running in your family, and the fact that you smoke and you don't do exercise, it can be contraindicated because like you have all those diseases running in your family. Have you tried to quit your habits? Because probably you're more prone to all those diseases.
I tried Chantix. I didn't like the side effects of Chantix to quit smoking, and it made me feel weird. So I stopped taking Chantix, and I also tried joining the gym. And,
besides feeling weird, like what else would you say about
I was having vivid dreams and stuff like that, so I didn't like it.
And does Chantix work for you in the time that you took it? Like it
did work.
helped you?
Yeah, it
The
helped
only
me stop.
thing you stopped taking it because of the side effects.
Yeah.
Okay, so have you tried any other type of medication? Probably like nicotine patch, something else to try to quit your smoking habits? And how about, do you want to quit smoking?
Yeah, I think I would like to. It's just that I think I will have to stop drinking first. If I can stop drinking, then maybe I can stop smoking.
So basically, that would be like a goal.
Yeah.
Goal for you. You know, like try to reduce your beers so that way you don't have the urge to smoke, and probably try to go. I know you already tried doing exercise, but probably if you go try again to run and go out and take a walk, I believe that would help you too with your habits. And in terms of getting, I would recommend you if you should get psychological help or any professional help, or probably counseling, group therapy, that it could help you cope with your anxiety and your depression, so you don't have to basically like go smoke and or drink when you feel anxious or depressed. Do you think that's something that would work for you?
It may work, yeah. I'll work on
Okay, Mr. Ramirez. So right now I'm gonna start with your examination. So what's today's date?
Today is December 1st, 2014.
Do you know time?
It's about 8:30 right now.
8:30. Okay. Do you know where you're at right now?
Yep, I'm in the nurse's office.
And do you know the president's name?
President's name is Barack Obama.
Okay, good. Okay, so I'm gonna start with your eye assessment and your head assessment. So I'm gonna go first, wash my hands. I'm gonna already wash my hands. I'm gonna put gloves on. Okay. So it is okay for me to touch your head. Okay, so I'm gonna check your head. I'm inspecting your scalp. Everything is okay. Your head. Right here. Do you feel any pain?